There are life stresses that are chronic that cause chronically elevated levels of cortisol in the body, which lead to exacerbated health problems such as obesity, type 2 diabetes, cardiovascular risk. And then there are stresses like I have a deadline at work that will come and go, and you can compartmentalize it to the workday. And the types of communities that exist in Englewood and Pilsen have a lot more of the chronic stresses than people who live on the North Shore. Being in Chicago in particular, where there is a lot of gang activity and a lot of violence, the neighborhood safety has a huge effect on the health of the neighborhoods. This is in terms of the quality of outdoor spaces, the safety of being able to walk down the sidewalk, because walking is the easiest form of exercise to obtain. In public health terminology, we refer to this as health disparities, and so things like cardiovascular disease and diabetes, type 2 diabetes, I should say, are more prevalent in these types of communities than in higher income communities. I think that the Affordable Care Act is, when executed properly, going to make a difference for a lot of people. I think that making affordable health insurance available to people who generally can't afford it, or under the old system couldn't afford it, is going to be an overall benefit, but it's taking a long time to get off the ground. Having the website not work is a huge problem if that's the key way that people are trying to access the healthcare exchanges, because if you can't get there, you can't get your insurance. Just knowing that it's out there is a huge barrier, especially in these communities where they're bombarded with a lot of bureaucracy and a lot of different types of entitlements that they don't know which ones they can apply for and which ones will help them, and if they do apply, if they're ever going to get it. It's scary to think about not being insured, to need a medication to maintain health, whether it's insulin to keep your blood sugar down, or test strips to monitor your blood sugar level, or being able to afford your asthma inhaler. Recently, it's been found that the standard aspirator in an inhaler was bad for the environment, and so it's been reformulated and repatented, so people with asthma can't afford their inhalers anymore unless they have good health insurance. So think about not being able to breathe, and that is what being uninsured feels like. I think overall, the Affordable Health Care Act, once it is properly implemented, will help a lot of people. And this struggle to get it off the ground is really heartbreaking for people who need those benefits.